Hello, everyone, and thank you for joining us. My name is Mackenzie, and I am the Community and Provider Education Coordinator for NAMI Maryland. I will be the moderator for our webinar today, along with my colleague Danielle Fletcher, the Communications and Outreach Coordinator for NAMI Maryland. We are so excited that you are joining us to talk about our advocacy priorities and gear up for our upcoming legislative session in January. Advocates like you allow us to lead rigorous and successful year-long policy efforts, and we are glad you are joining us in this discussion today. Your input is crucial to guide our work for the rest of this year. If you haven't already done so, please take our brief survey to rank these various advocacy issues in order of importance. We will place the link to the survey in the chat and will include it in our follow-up email tomorrow as well.
Before we get started, we wanted to note just a few housekeeping points. To avoid background noise, all participants will be muted for the duration of this webinar. We'll be addressing questions at the end. If you have any questions as the webinar continues, please enter them in the question box, which is located on the right-hand side of your screen if you're viewing from a computer, or at the bottom of your screen if you're viewing from a phone. We'll then be reviewing questions as they come in, and if someone in particular is unclear or needs to be expanded upon, we'll ask Maura to do so when the question is asked. If you have any comments or concerns during the webinar or any tech issues, please also enter those into the questions box. We'll review and address any immediate needs as they occur. A recording of this webinar will also be emailed to each registrant tomorrow. The recording will also be available on our website at www.namimd.org for any individuals that were unable to register or attend today.
I'd like to now hand it off to our policy consultant, Maura Cyphers.
Hi, good afternoon, everyone, and thanks for making time to sign on to this webinar and learn a little bit about our legislative and policy work. Danielle, if you could flip to the next slide, please. So I think pretty much everyone on the call should be familiar with me, but if not, I'm Maura Moynihan-Cyphers. I am NAMI's policy and advocacy consultant. Josh Howe with Compass Government Relations is also on our team. I have been a NAMI member, former NAMI board member, and worked with Kate for a number of years. And we're feel honored to work with NAMI Maryland and are always available for outreach, questions, clarification, assistance. So I'll post my contact info at the end of the webinar, but please always feel like you can get in touch with us. Kate Fahrenholt, the Executive Director, NAMI Maryland Board of Directors and Policy and Advocacy Committee help guide our work. Affiliate leaders provide lots of good input and heads up about bills or other local issues. NAMI grassroots members, and honestly, I should include Danielle and Mackenzie because without them, you guys wouldn't know about our good work, and they help us message and make sure we're staying on track and providing the updates and resources that NAMI members need. Next slide. So NAMI Maryland's advocacy, today we're going to focus on legislative advocacy, but our work is year-round, ongoing. At the end of the webinar, I'll be touching on some behavioral health hot topics. Those are some good examples of non-legislative work, but it's pretty continuous, and Kate Fahrenholt does a fair amount of it. The focus of our next 4 advocacy calls will be legislative session. Our public policy and advocacy work during the legislative session moves very fast. The legislators meet only from January to April. That's the only time to get any bills passed. This year, major change will be mostly virtual. And I think for grassroots advocates, that is a good thing. It's an additional level of transparency that folks don't always get. So for example, if you're very familiar with the legislative process, voting sessions will be live streamed. And so that'll help give a little bit more context and ideas about where legislators stand on particular issues. And bill hearings will all be live streamed too, which means we'll be able to schedule you in if you want to testify, and you can testify from the comfort of your home. That means no taking off a full day of work, coming to Annapolis, dealing with the snow and parking. We're we're pretty excited about that. So in-person advocacy is very important, but we're going to do what we can to take advantage of all the technology available to advance NAMI Maryland's legislative priorities. In the past couple of years, we have approached 3,000 bills. The pre-filed bills aren't out this year, but they should be coming soon. And once they do, we'll be culling through them to see what's been introduced. And just to give you guys an idea of what NAMI gets involved on, last year we provided testimony that's in person and written at more than 50 bill hearings, monitored more than 90 bills, and that's not counting budget related work. We partner with a number of folks in the Behavioral Health Coalition, and that helps expand our reach and our advocacy on priorities. And then finally, we are doing an advocacy day. It'll be virtual, but please join us. We're going to get creative with it, and hopefully it'll be worth your while. Next slide, please. So, legislative session 2021. How do we figure out what to support when there's that many bills and so many areas where NAMI can be influential and get involved? We do unfortunately have to triage a little bit because, you know, like I like to say, you can be mediocre at a lot of things or great at a few things. And, you know, NAMI's grassroots members are motivated. They're great with outreach when we send out advocacy alerts. And so we want to make sure that we're really targeting legislative advocacy priorities that make sense and will help our membership. So always and available on online is the NAMI Maryland Public Policy Platform. That's sort of the guiding document. If you have a question about NAMI's position on anything, it's online. It's 7 pages long. NAMI Nationals is like 70 pages long. And so that's just a public record that is reviewed and approved by the board every year of where we stand. Our legislative advocacy priorities and policy priorities, we've got 3. I'll be getting into those in a little bit, but that is really what we use from year to year to help guide and refine our policy and advocacy work. Policy and advocacy surveys, those should have gone out, I think, once or twice. I know Danielle has been pushing them out. So if you have yours, fill it out or ask us to resend. We'd love to hear from you and get your thoughts on policy and advocacy. And then we also get bill ideas and hear about potential issues from our various legislative coalitions that we serve on. And then are contacted directly by legislators, and we've got a couple of those bills already this year that we're working on. Next slide. This is just where you can find our public policy priorities. I kind of already covered them, but FYI, please review, and I think it'll help give everyone a sense of who NAMI is and what we stand for in terms of policy. Next slide. A couple quick notes before we get into the issues. Like in other sessions, there will be other bills, and the list that we cover on these monthly calls will grow and grow and grow to work to or oppose. And just with close to 200 members of the legislature, we can't predict or know what's going to be introduced before it is. And just a note about NAMI's positions, 90% of the time, you know, we're supporting with amendments. We typically work collaboratively and are, you know, not in the business of killing bills unless they're very bad. Our legislative priorities kind of reflect our stated priorities, but we do leave room for legislation we can't anticipate prior to introduction, or, you know, sometimes current events dictate us getting involved on an issue we couldn't have predicted. If that's the case and it's truly a departure, there's a board process to make sure that my work, Kate's work, the staff's work is receiving the amount of appropriate oversight it deserves. So if we're changing course, the board will know about it, and there will be, public record on that. Next slide. Okay, so here are our legislative advocacy priorities. Nationally, these are the priorities that NAMI is putting forward. We are intervening early, we're improving care, and we're diverting from criminal justice. On the whole, it's not a huge change from our legislative advocacy priorities in past years. They are reordered, and I think the message is a little bit more clear, which is really helpful when you're trying to transmit to a Hogan administration official or a legislator who may only have 10 or 15 minutes and frankly a limited attention span to say, here's what we want to do, and here are our areas of interest and what are you working on, and here are our priorities. So intervene early, improve care, divert from criminal justice. Next slide. What do those things mean? So early intervention, I think probably everyone on the call knows. And so I'm not going to read through this slide, but a couple of key points I want to focus on: integrating behavioral and physical health. So coordinated care models that integrate physical and mental health services. It's huge for patient outcomes, for saving money and reducing stigma. NAMI has run a couple pilot programs focused on this in the past, and the outcomes are incredible. And so, that will continue to be a focus for us. Mental health in schools, public and private elementary schools, students should have access to school-based mental health services that are appropriate for their ages. There was sweeping education reform last year that we discussed several times. It's the shorthand for it is the Kerwin bill. It included more than $300 million for school-based mental health services. The governor vetoed that bill. We expect that there will be a veto override, but there are some outstanding questions about how the education reforms will be paid for, because the $300 million is only a small part of what will be a $4 billion reform of our public education system. The pandemic has contributed to some losses in state revenues, which means, things that we had budgeted for previously may be on the chopping block, and NAMI plans to be involved and as supportive as possible for retaining this expansion and this funding. And then mental health screening. So that's part of mental health in schools, and I'll talk a little bit about other legislation we know coming down the pike on that front. Next slide. Improving care. So ensuring that Marylanders have the best possible access to care. We have spent a lot of time and a lot of effort on trying to hold insurers accountable for providing behavioral health services at the same rates of availability and accessibility that they do for somatic or basically healthcare below your shoulders. And our work on parity will continue. It's really tough. I think anyone on this call who has tried to get an appointment for themselves or a loved one knows that access to therapists and psychiatrists and psychologists that are covered and accept insurance is hard to obtain. And if you need an appointment right away, there can be really long wait times, or you're driving far out. So all of those things kind of fall under parity, and our work continues on that. Medicaid supports and funding. We will talk a little bit more about what's going on with Medicaid and behavioral health today, but NAMI perennially, we always support budget increases for our providers and for critical programs that help Medicaid recipients. There are more than 300,000 adults and children in our public behavioral health system, so that's Medicaid, and access to care and making sure that that's adequately funded is always a priority. And then protecting veterans' access to mental health care. So NAMI's done a lot on the veteran front and trying to expand NAMI programming and services and support groups to veterans, Maryland has a really high veteran population, and we know as the pandemic proceeds that rates of suicide are increasing, and veterans are more likely to have mental health issues, including depression, anxiety, PTSD, and of course addressing the high rate of suicide. So those are some of the biggies under improving care. Next slide, please. And then diverting from criminal justice. My own personal take is this is an area where NAMI continues to excel, and we define ourselves a little bit from others in the Behavioral Health Coalition in that we focus a lot on criminal justice and the impacts that diversion can have in terms of really making sure that folks are getting the help they need and they're not being locked up or punished for being sick. I like what we say here, which is NAMI fights for policies to get people help, not handcuffs. So two big sort of sub-policies on this front. Crisis services, the lack of mental health crisis services across the US and in Maryland have resulted in law enforcement serving as first responders. And across the board, we need increased funding, better services, improved cultural understanding, and direct handoff to healthcare. So we have historically supported a wide variety of bills on that, including leading on the creation of the CIT, the Crisis Intervention Team Center of Excellence, where we helped basically create a small state agency that's going to be coordinating work among state agencies who do CIT work, and then among local law enforcement and local jurisdictions to take our CIT beyond the 40-hour training and really get kind of the robust data gathering and connection to services that a fully implemented CIT program has. And then strengthening state supports for the hardest to treat. There are so many conversations progressing on this front. Some of them are stemming from the Lieutenant Governor's work, some of them stemming from the legislature, but I think if you can call it a silver lining, the pandemic has really shone a spotlight on our lack of access to care and resources, especially for folks who are in crisis and who are struggling. So diversion from criminal justice remains an important NAMI priority, and really an area where we continue to do the most good we can. Next slide, please. Okay, so legislative advocacy priorities and action. We're a month away from session starting, and we already have an idea of some of the bills that we'll be working on and engaging and making priorities. And some of these have come from legislators, some are NAMI-led, and some are coalition work. So it's a mix of everything in here, but I already touched on defending $300 million in funding for school-based mental health services in Kerwin. We will absolutely be on the defense and working with our partners in the education space on this. We were approached by Delegate Palakovich-Carr and Senator Malcolm Augustine. They are working on legislation to include suicide prevention numbers on college IDs. So we recently had a big meeting with the University System of Maryland, the Independent College Association, bill sponsors, and then other folks in the Behavioral Health Coalition about the bill and working out some of the kinks and details. So I think making sure that college students have access to 24-hour crisis services is very important. And so it sounds like a small change, but it could truly have a pretty big impact. And then ACEs training and response. So ACEs stands for adverse childhood experiences. Kids, we know ACEs kids who grow up with trauma have worse mental health outcomes, worse graduation rates, worse physical health outcomes. I mean, the really kind of spans the gamut. And so this is, I'm talking about legislation for pediatricians and for educators to be able to recognize the signs of trauma and figure out the appropriate response system so that we're intervening early and getting these kids, and in many cases families, the resources they need to get well and support one another. Under improving care, I think we will have plenty of other bills to file under there, but something we've been working on since the fall with the Parity Coalition is protecting telehealth expansions. So during the pandemic, the federal government and the state government expanded how behavioral health services are provided via telehealth, which means asynchronous communication, so that's texting or emailing with a provider. A big one is coverage for Medicaid patients that wasn't previously approved. And then being able to do telehealth appointments from your home. Kind of sounds funny, but prior to this, folks had to actually go to a healthcare facility to then do a telehealth appointment. And the whole point is being able to do it from where you're at. And beyond this, you know, I think these expansions are great for care during the pandemic, but it's also what we're finding encouraging individuals who may not have sought care either for mobility or transportation reasons to be able to more easily access care. So expanded telehealth really removes barriers to care, and this will be a priority of NAMI's for sure. And then under diverting from criminal justice, a couple of issues we already know and anticipate coming up. Expanding the definition of mobile crisis units or mobile crisis teams to incentivize diversion, improve cultural competency, strengthen the use of peers, and increase funding for these services. So I'm going to spend just a little bit of time on this. There have been some tragic law enforcement interactions with individuals who are clearly in crisis here in Maryland, including the shooting and killing of people. And without appropriate dispatch protocols and really going beyond law enforcement training, but figuring out who needs to respond to these calls and how they are trained and what they know going into communities, and then how those handoffs and follow-up help support an individual instead of, again, putting them in the criminal justice system is really going to make a difference. A couple of years ago, we worked in partnership with other members of the Behavioral Health Coalition to create the Behavioral Health Crisis Response Grant Program. It was $12 million of grants to be paid out, I think, over 3 or 4 years. And so part of our efforts this year will be to not only increase funding, but earmark a fair amount of that funding for the expansion and support of mobile crisis units. And it's our hope, if folks have been following the work of GBRICS, that's the shorthand for regional crisis response, and I think Baltimore, Howard, and Baltimore County, that's going to create kind of a one-stop shop in terms of having a specific number to call when you're in crisis, making sure that there's appropriate diversion, and even working with 911 dispatch to move crisis calls over to that system, and then getting folks into community care as soon as possible. You know, we're working to make sure that all of these goals align and are complementing and working together to expand the crisis response system in Maryland. And then we're also planning to work on implementation of the CIT Center of Excellence. So I touched on that a little while ago, but the bill officially went into effect in October. Right now, it's housed in the Governor's Office of Crime Control and Prevention, and we are working with them to create the CPIC, which is the Planning and Implementation Committee for overseeing the Center of Excellence work. And it's sort of early days, but really exciting that crisis response is getting, we think, the attention that it deserves. Next slide, please. And we are almost at the end of the presentation, so we'll have plenty of time for some questions. So behavioral health hot topics in 2021. I think we're in at least the second year of this commission, but the commission to study mental and behavioral health in Maryland. The commission is headed up by our Lieutenant Governor, Boyd Rutherford, and it's taken a sweeping look at access to services. And what's coming out, they've created, I think, 4 or 5 subcommittees, and one glaring issue has been improving crisis response and then providing access to care for those who need it the most. And NAMI, we've worked with a number of the subcommittees and provided recommendations to them. Several have been adopted. And I think the one, if I may speak for Kate, I know she's on, but is the need for sequential intercept mapping. So this is an issue that Kate in particular, NAMI Maryland, has been working on and led on, but this takes a look at, I think there are 5 plus where an individual comes into contact with the criminal justice system. So that's each intercept and what we can do. So it breaks it down from intercept 0 to intercept 1 to, so that's maybe like getting arrested. And then I think intercept 2 is the courts. And so it's breaking it down. Where can we divert and what can we do, and what community collaborations exist, and what supports and resources exist, and where don't they? And having a statewide examination of this is critical, because the need changes from region to region, and sometimes it's small and affordable adjustments that can really make a big difference on diversion. So this is really exciting. The Public Safety Subcommittee actually won a SAMHSA grant to create this SIM Summit, which NAMI and Kate participated in mid-November, and now we're working on some policy follow-ups from the summit and how we can improve diversion at each intercept. The Lieutenant Governor and the BHA Secretary, they're also reviewing how Maryland provides services to hard-to-treat and reach Marylanders. And we've provided policy advice and guidelines regarding assisted outpatient treatment at their request. And so lots of background information, lots of best practices, and we're working with BHA on other policies to expand existing programs like the Outpatient Civil Commitment Pilot Project. So NAMI Maryland's been on the Stakeholder Advisory Board for OCC for a number of years. There are other programs, but just interest in and worth note about the renewed interest from the Lieutenant Governor on AOT. And then Optum issues. If you've read the Baltimore Sun lately, you will know that our ASO, the organization that runs our public behavioral health system, they switched from Beacon to Optum last year, and it's been chaotic. The impact to providers has been enormous, and we just had a meeting where they're not at the point yet, but they may have to start turning patients away because they can't make payroll, they can't make rent. Optum keeps denying care and claims for administrative issues like a signature's in the wrong place. So it's not that they think someone's not qualified or that they need to go somewhere else for care. It's like you didn't check this one box. And to add to this problem is that Maryland opened enrollment after the pandemic began, and so many people were laid off, and there are now 60,000 more people on Medicaid. And so figuring out a way to get new patients in the system has been virtually impossible. So we are working with coalition partners, urging the governor and BHA to make a change or figure out how to hold Optum accountable. We're partnering with providers, and I want to make a plug here because you'll see in the next couple of weeks some email education come out from NAMI on this. But if you or anyone you love is on Medicaid and you've had issues with services, let us know. I think a legislative solution is not off the table. Rebidding the contract is not off the table. It's I think an unqualified disaster based on what we're hearing. So Next slide, please. What can you guys expect in terms of communication? So during session, we'll provide brief weekly updates via email on legislative priorities, in addition to other regular updates and also advocacy alerts. So in the past, it's been really great. And if there are affiliate leaders on this call, making a priority to forward our advocacy alerts would be so helpful. And maybe we'll include email reminders periodically about it, because that outreach, just calling your legislator, sending an email on an issue, really can make the difference and help us win votes on some pretty tough issues. And then during session, we'll host monthly calls with advocacy updates and opportunities for questions. And we'll also provide a webinar to prep for Advocacy Day attendees. Again, it'll be virtual, so things will be different. You may want to sign up for that one. And then, like I mentioned at the top of the call, please reach out to me and to NAMI staff with questions for bills. Fill us in on meetings with local leaders. I'm just going to shout out Howard County because they're always really good about that. And it helps us do our job and make sure that we can say, oh, hey, Senator Fry-Hester, we know you just met with your local affiliate, and how can we be helpful? So we're here to help and partner, and I want to thank everyone for their time today, and we'll just open it up for some questions and discussion. Danielle, are you running point on questions, or do you want me to, I can just start going through them. What is the name of the vetoed education bill? I think it was House Bill 100, and I think it was the blueprint for Maryland's education future. But again, the shorthand for the bill is the Kirwan bill. It's K-I-R-W-A-N. It's named for the former chancellor of the University of Maryland, who chaired this multi-year commission, Britt Kirwan. Will the new program include DPSCS Division of Parole and Probation? I think Tiffany's question is about the CIT Center of Excellence. And if so, yes, that's the goal. So there's CIT work going on at BHA. There's some CIT work that was going on at GOCAP. There's CIT work going on in corrections. And I believe at the Maryland Police Standards and Training Commission too. And that's not even to say what's going on at the county and municipal level and their local law enforcement. So yeah, the goal of the CIT Center of Excellence is to draw all of that work together so that collectively state agencies, law enforcement, and local government can provide support, can draw down federal funds to increase resources for CIT programming, and to share data information to better create our crisis response. Stacy has a great question. When you are monitoring 3,000 plus bills, how do you strategize on what takes priority? Alignment with our priorities. Also, what actions to take to garner support, phone calls, emails, etc. That is such a good question. Okay, so when you're monitoring 3,000 plus bills, how do you strategize what takes priority? There is absolutely a calculus that goes into it. And so, we can put aside at least 2/3 of those bills as not having impact, but then taking a look and having, I think, the institutional knowledge of what's been introduced, how far it's gotten in the past, can help us weigh its likelihood of passage. And that's one way. Another way that we kind of put weight on bills is using our policy priorities. So intervening early, improving care, and diverting from criminal justice. If it falls into one of those categories, it immediately raises the priority. And then because there are so many bills and we kind of have an idea in the first month of session, okay, here's here's where we're pushing, here's what we're doing. The rest is all triage. And so Kate and I go through the bill list week after week and figure out, okay, this is what's being heard and what's our position on it. And sometimes a bill rises to the top because it becomes an urgent priority. And others we can say, okay, we'll just write testimony because it's not, you know, not directly within our wheelhouse and we like it, but it's not a priority. Another way bills take priority really is if affiliates and members reach out to us and say, this is important and here's why, or we met with our local officials and they told us they're putting in this bill and we'd love for NAMI Maryland to be involved on it. So we do try to give weight, and you know, I'll shout out NAMI Metro Baltimore here. They have a couple bills that they support and ask for our support on every year, and we're always happy to do that and provide that support because it's important that we're all working collaboratively to support, you know, NAMI and our affiliates' priorities. And then what actions to take to garner support? Phone calls, emails, yes, that's great. We will help provide resources in terms of who to call and when and about what, but one thing I always say, and you'll hear me say during Advocacy Day presentations, is it's so good. And if you've done the NAMI Smarts for Advocacy training, I think you'll know how important this is, but sharing your story. So even if you don't know what bill number or what's important, if you run into someone who is a delegate or a senator or on your county council and you want to share with them, hey, I'm having a heck of a time getting my son treatment, or the cost of my prescription medication has gone up, or I think anything you can do to talk about your own personal experience, that not only does it help reduce stigma, which is so important, but it also just, you know, puts NAMI front and center in their minds and helps them connect what we're proposing in legislation to actual members of their community and puts a face to it. So never be afraid to advocate, even if you feel like I'm not an expert or I don't know all the details, because you know, that's what we're here for. And so, you know, we need your voice and your bravery and your outreach too. Can you email us the slides? Yes, Lori, we can absolutely email the slides. And I believe the webinar is recorded and will be posted too. So if you want to share it with anyone or need additional information, let me know.
Yes, and more of the recording is being sent to each registrant tomorrow, and it will also be uploaded to our website at www.namimd.org.
Wow, okay, I didn't realize we have a ton more questions. Sorry, the box looked really...
Yes, we have lots of questions coming through.
Okay. What policy, advice, and guideline recommendations did you make regarding AOT? Lori, I'm happy to, I think if it's fine with Kate, it's a public letter, share the letter and guidelines we provided to the Behavioral Health Administration and Lieutenant Governor. Largely followed some of the APA recommendation, and we worked really closely with NAMI National and their policy people to make sure that we got it right. But the bottom line is it would need to be a systemic wholesale change, appropriately resourced, and there'd need to be a lot of work with providers to make sure that they understand the program. And I think, you know, it bears repeating and bears putting in mind that this is for a very small population of Marylanders for which, you know, community care is not working. How do we get new bills initiated, such as getting a D for disability identified on the state and federal issue identification card? Talk to us about your bill ideas and talk to your local legislators. So it is, I'll say, absolutely a challenge to pass the bill, but we're open and willing and available to talk and be a resource and help you figure that out. I'm interested in the timeline of AOT implementation for severe mental illness and civil commitment for those individuals who refuse treatment. Thanks for the question, Teresa. So right now, the conversation is at the commission level with the lieutenant governor, so there have not been any policy decisions made at that point. So unfortunately, I can't provide a timeline on that front. That said, session's coming up, and if the lieutenant governor chooses to act and is introducing a bill, we'll certainly plan to be involved and work and support that. Based on my knowledge of the information gathering he's been doing and that the Behavioral Health Administration is doing, I would say they may not be there yet, but certainly wouldn't rule it out in the future.
So our next question, where I'm not sure if you can see it, is what are mobile treatment units?
So mobile treatment units or mobile crisis units are teams that are dispatched when there's a call to provide better crisis response and divert folks from law enforcement interaction. So they coordinate with police, fire, EMS, community responses to help make sure that folks are going to like a healthcare setting to de-escalate crisis interactions. And I think it's a more of a community-based approach than just sending out a police officer for when someone's in crisis. So it's a response that's not, the focus isn't law enforcement, but hopefully more healthcare based.
Perfect. And our next question is, the Lieutenant Governor's Commission has been looking at the barriers created by the danger standard for emergency evaluation and involuntary hospital admission. The year-end recommendations are being held up by waiting for a white paper from Mental Association who opposes any changes. The Commission wanted to hear all voices. Does NAMI plan to submit their policy recommendations to the Commission before the end of the year?
Yeah, thanks for the question, Evelyn. I know that we've been in touch on this directly too. And the next opportunity to comment, I believe, is in January. So we're happy to talk more about the danger standard and look at what you're putting forth. And, you know, I think if it jives with what NAMI is doing and makes sense for us to support, you know, we can absolutely work together on that.
Our next question is, do Maryland priorities ever differ from national? Are Maryland priorities driven by Maryland specific needs? And does national need to approve, support state chapters policy priorities?
That is such a good question. I think the affiliate model of NAMI makes a lot of sense because we have, you know, leadership from national, but we also have, and support, but also a lot of autonomy. So I think, you know, they put trust in the Maryland chapter to understand what needs and what concerns our state and our communities face. And so we have a lot of autonomy in picking, okay, here's what we're doing, here's what we're going to work on. Kate is on I think calls and national ED list, executive director list. And so we will get questions like, okay, this is what's going on in Wisconsin. Do you have response? And so we'll say, this is the bill that we did, or here's the model language that we're using, and vice versa. And then I get on, we are also doing statewide policy and advocacy network calls once a month. And lately I've been focusing on pandemic response and state budgets and getting what you want out of a state budget. And so I think there's a lot of collaboration and support from national, but they don't need to approve or I think support our state chapter's policy priorities. I could be wrong, but we've never run afoul of them before. And it's a very collaborative and helpful relationship.
And I apologize, my microphone got unplugged at some point during the call, so I'm back. So the next question's from Carrie, and it says, any more details on what the ask will be for affiliates on Advocacy Day?
Not quite, Carrie, and here's why. I just got the guidelines for how, for example, bill hearings are going to run. They still haven't figured out how budget hearings are going to work. So generally what I plan to recommend, and we'll hopefully get this out as soon as possible, but setting up, what I'd like to do is have folks set up meeting with their local representatives and then do some strategic targeted meetings. So for example, with Metro Baltimore, members of the Baltimore delegation who serve on the committees where we do our most work. So that's usually HGO and Judiciary in the House, and then the corresponding committees in the Senate, which are Finance and JPR, to talk about our big issues. And so I think it's kind of a strategic deployment so that you guys are having quality meetings and can help us, you know, advance our legislative goals. But it's just been tough because the planning has been slow, and the state needed to get, it's probably too much information, but they need to get approval from the Attorney General on when and how they could take votes and hold hearings. And so the short answer is yes, we're going to need your help scheduling meetings, and I would like to make sure that those meetings make sense for what we're working on, but also for you guys to build and, you know, maintain your own relationships with your local officials.
Awesome. And the next question is from Tiffany Brown, who asks, why was the behavioral health insurance changed from Beacon, and who's involved in that decision?
It was changed from Beacon to Optum for one primary reason, which was cost savings. So the state puts out an RFP and says who can run this program, and then many times they prioritize how cheaply they can do it. I think that is problematic, and this is really my own personal editorializing, but services cost money, and so it doesn't always make sense to go with the cheapest option. And I think there were certainly issues with Beacon, but nothing compared to what's been going on with Optum. And it's, you know, not only is it a distraction, a potential barrier to service, a disincentive for providers to work with the state and take Medicaid. It's really something we got to fix, and we'll be working on that.
Our next question is from Evelyn. That says, the head of Maryland Medicaid has committed to applying for the federal IMD hospital waiver for serious mental illness next year, which would not go into effect until January 1st, 2022. State funding for IMD hospitals was reduced this year. Will NAMI Maryland advocate for increased funding for IMD hospitals like Sheppard Pratt until the Medicaid waiver goes into effect?
Yes, absolutely. Sheppard Pratt is one of our good partners, and we're always open to working on that. Yeah.
I think that's all of the questions so far. Mackenzie or Maura, do you see any others that I might have missed?
I
think we got them all.
Okay, cool. Well, you guys can have 9 minutes back on your Thursday. I hope everyone has a healthy and safe holiday. Like I said, please be in touch if you have questions or something comes up after the call. If you've got feedback about the call, how we can do better, what level of detail we're providing, let us know that too. And I really appreciate everyone spending this hour with us, and especially Danielle and Mackenzie for running such a great call.
Karen just came in with one last question, which is, what is our Maryland NAMI contact information? You can contact us on our warm line, which is 410-884-8691, or you can email us at info@namimd.org, and we'll put that in the chat as well. You'll also get a follow-up email tomorrow with the recording, with the slides, and with different ways that you can contact us for more information.
And if you haven't already done so, be sure to take our brief survey to rank all of the advocacy issues in order of importance. We will also place that link in the chat now for everyone too. Thank you so much, everyone, and we hope you have a great day.